Hello guys, how are you? I hope so that you will be fine and enjoying good health. Today I have selected a topic on deja vu. What is deja vu? First defined in 1983, deja vu is an exceedingly common mental state that is transitory in nature and described as a subjectively inappropriate impression of familiarity of a present experience with an unidentified past. It translates from French as literally as already seen. Colloquially, it is often used to describe familiar events or experiences, while in medical terminology, it refers to the disconcerting perception that a novel experience is familiar. Clinically, deja vu is sometimes understood as a manifestation of a mental or neurological disorder, most commonly temporal lobe epilepsy, TLE, or schizophrenia. Epilepsy is a neurological disorder caused by abnormal electrical activity within the brain and characterized by loss of consciousness and seizures. Temporal lobe epilepsy is the commonest form of epilepsy, accounting for approximately 60% of all people with the diagnosis. The subtype affects the hippocampal region, the area of the brain responsible for the processing and storage of short and long-term memories. And research has shown a strong association between deja vu and seizures in people with temporal lobe epilepsy. The relationship between the two types, the two was first described in 1888 as a dreamy state occurring with TLE. Subsequently, a large body of research has shown that many individuals with TLE experience deja vu as a manifestation of accompanying seizures, often immediately prior to convulsions. In schizophrenia, experiences of deja vu may be longer, more intense, and accompanied by feelings of depersonalization. Also referred to as derealization, it is a state of detachment whereby thought seems unreal and individuals feel as though they are external observers of themselves. However, when the prevalence of deja vu is compared between individuals with and without schizophrenia, the frequency of deja vu is higher in the neurotypical individuals. People with schizophrenia, however, experience deja vu as more distressing and disturbing and are more likely to experience them under physical or mental duresses. A follow-up study by the same author explored why schizophrenic people may experience deja vu less frequently and found an association between deja vu and negative symptoms of schizophrenia and deja vu and antipsychotic medications. Individuals with schizophrenia who exhibit more negative symptoms such as poverty of speech, reduced motivation, and social drive have fewer deja vus than those with fewer negative symptoms and healthy controls. It may be concluded that the brain dysfunction underpinning negative symptoms likely interferes with deja vu experiences. Conversely, the frequency of deja vu experiences is increased in the subtype of schizophrenic patients who are on higher dose of antipsychotic medications. Arguably, this may account for previous false associations between schizophrenia and deja vu. Furthermore, there is no obvious relationship between deja vu and positive symptoms of schizophrenia such as delusion and hallucinations, suggesting that deja vu experiences are not related to the mechanisms involved in these symptoms. Taking the results of these studies together, deja vu is thought to exist as a non-pathological phenomenon. Given that the deja vu has a lifetime prevalence of 60 to 80% in non-clinical samples, it is clearly not always pathological. On the contrary, careful distinction between colloquial and true experiences of deja vu in clinical context can separate a typical experience from a neurological or psychiatric condition. Warren Gash and Zeman in 2003 proposed a useful clinical assessment framework for distinguishing between pathological and non-pathological deja vu, and these experiences should be assessed with respect to both frequency and type. And frequent colloquial deja vu and isolated and transient deja vu are considered normal. For experiences of true deja vu to be indicative of pathology, they must be accompanied by other symptoms such as hallucinations, seizures, depression, anxiety, or dissociation. Several theories pertaining to deja vu experiences in non-clinical samples have been suggested. Then such explanation assume that deja vu occurs when an individual has previously experienced a highly similar situation, memories of which have been processed and stored unconsciously rather than consciously. And deja vu experiences are triggered when an element of the novel situation activates the unconscious memory. For example, when a single element of an event is known but the context novel. In these situations, the brain generalizes this familiarity, evoking the deja vu experiences. The neural transmission speed. This hypothesis is based on the speed with which information travels through the brain and describes the potential for processing errors in two pathways. In single pathway process errors, there is a delay in the transmission of a single piece of information to the brain, and a false sense of familiarity is triggered when the transmission is eventually delivered. In dual pathways errors, one pathway is delayed while the other functions normally. In this process, the deja vu experience is generated when the focus between the two pathways changes rapidly. Then divided attention. This theory suggests that deja vu experiences are elicited when attention is divided between simultaneous perceptions within a single event. While the brain is subliminally processing the environment, one singular observation is momentarily distracting and takes our full attention away from the environment. When it returns, the sensation of vague familiarity that is observed in deja vu is generated. This was propagated by the Brown in 2004. A definitive account for the phenomenon of deja vu remains elusive, though not a core feature of mental illness. It can arise as a part of a wider pattern of disturbance in some disorders. However, among healthy population, explanation of deja vu mostly point to a temporary error in cognitive processing. Deja vu describes that uncanny sensation you have already experienced something even you never have. Experts generally agree this phenomenon probably relate to memory in some way, or if you have deja vu, you might have experienced a similar event before, you just cannot remember it. Deja vu is a false sense of familiarity. Dr. Corey says your brain creates a sensation as if you have lived a certain situation before, but you are unable to retrieve it from your memory and cannot identify the actual situation. Deja vu, already seen, is the experience of already experiencing something, and jamais vu, never seen, is the experience of being unfamiliar with a person or situation that is actually very familiar. The next level of early warning signs of psychosis include acquiring odd beliefs or expressing magical thinking. This can include claiming to experience deja vu frequently, thinking that others can read their thoughts, or thinking that a dream is actually reality. They also reported experiencing deja vu more frequently and with higher intensity during periods of high anxiety. In addition, the anxiety group reported finding deja vu episodes significantly more distressing than the control group. Sigmund Freud, the developer of psychoanalysis, proposed that deja vu happens when a person is spontaneously reminded of an unconscious fantasy. Because it is unconscious, the content of fantasy is blocked from awareness, but the sense of familiarity leaks through and results in the deja vu experiences. Temporal lobe seizures begins in the temporal lobes of your brain, which process emotions and are important for short-term memory. Some symptoms of a temporal lobe seizures may be related to these functions, including having odd feelings such as euphoria, deja vu, or fear. While deja vu is instantaneous and fleeting, deja vu already lived is far more troubling. Unlike deja vu involves the sensation that a whole sequence of events have been lived through before. What's more, it lacks both the startling aspect and instantly dismissible quality of deja vu. Deja vu experiences were observed in 53.1% of the schizophrenic patients. Patients with increased negative symptoms, blunted affects, motor retardation, emotional withdrawal, conceptual disorganization, and mannerisms had deja vu experiences less frequently. The feelings of deja vu is commonly a warning sign of an oncoming seizure with a panic afterwards. A neurologist is warned you need to be seen to try and strengthen out whether these are truly seizures or panic attacks. Petit mal seizures mimic the effects of a panic attack in many people. Categories of Deja experience in 1964, Professor C.T.K. Cherry, former professor and chairman of the Department of Philosophy and Psychology at Madras Christian College, published a paper in which he divided instances of deja vu into three categories, such as number one was pathological and two was normal, and the third one was precognitive and telepathic. But which one and when? The paradox of deja vu makes forecasting nearly impossible. Though many of us have seen this movie before, we should expect it to remain unpredictable every time. Carl Jung suggested it arose from tapping the collective unconsciousness. Dozens of causes of deja vu have been proposed over many decades, remarks Flaherty, Craig, but most fall by the wayside as researchers learn more about the human brain and cognitive processes. Of 12 consecutive patients with bipolar mood disorder satisfying DSM-3 criteria, 6 were discovered to have 5 or more psychomotor epileptic forms. All of the 6 had olfactory hallucinations, metaphorsias, and multiple deja vu or mystical experiences. Deja vu is the phenomenon that a person experiences when they feel that they have experienced an event in their past. Study shows it's not a psychic experience, but rather a little trick the brain does. Deja vu, however, is something different and there is no trick to it. Deja vu is evidence of a deep mnemonic architecture of consciousness and emblematic of what it is like for animals like us to navigate in and to cope with the environment of our concern. I suggest that deja vu involves a specific distortion in a dynamic of repetition and recognition. So it was all about the deja vu, and I hope so that this topic would be more informative for the audience. And if you have liked this video, then kindly share video with other individuals as well and subscribe to my channel. Have a wonderful nice day. Thank you for listening this video.